Hello again. Time for another installment in your Medical Nutrition Therapy 1 course. Today, in this brief presentation, we're going to be discussing the scope of practice. Now, the Academy, for most specialties in dietetics, has a scope of practice. So if you are a dietitian working with HIV/AIDS patients, if you are a dietitian working with pediatrics or even diabetes and many, many more, you will have your own set of practice guidelines. And you can find all of those on the Academy's website. If you go to the journal, it should be there. Today I'm just going to bring out one from oncology. It's the one I'm most familiar with because I have recently worked in oncology. So, to start with, you will grow a lot as a dietitian. And a lot of you will feel like you're getting ready to start the internship and you're so not prepared. You just don't feel like you know enough. And that's very normal. In fact, the first several years as a dietitian, you will go back and you'll be looking through your notes and you'll be asking other dietitians that have been there lots of questions, because it takes several years for you to feel comfortable and confident with your interventions and your guidelines for each patient. So that's very normal, and that's kind of what the scope of practice is reassuring dietitians, is that there are different levels, and as a dietitian you'll move through these levels depending on which scope or what area you're most interested in. The scope of practice, by definition, according to the Academy, encompasses the range of your roles, the activities that you do, and even specific regulations within nutrition and dietetics. And those are all things that you will perform as a practitioner. So things that you will do on a daily basis in that profession is all included within this scope of practice. Our focus as dietitians is on food, nutrition, and other related services that are provided by the RD. And just like we talked about with the Code of Ethics, all of these things are done to protect the public, the community, and the populations of people living within our community and outside of our community. There are several focus areas, and we'll kind of highlight some of those as we go through. This slide here compares the role of the dietitian and the role of the diet tech who's registered. Now, in the future, hopefully, there will be more registered diet tech positions available. Right now in the state of Kentucky, we do not have a lot of opportunities to become a diet tech and work, but hopefully in the future that will happen. So these over on the far left in the nutrition care process, all of these things should be familiar to you. This is the ADIME, or the nutrition care process. And we follow these across. So a nutrition assessment, the dietitian can perform all pieces of the assessment. You know, the dietitian can evaluate labs, the dietitian can overview any medications, do any sort of body composition measures. However, if we look at the diet tech's role and her scope of practice, she can assist with data collection. She can identify labs that might be at risk, and she may be able to screen patients for that risk, but she is not allowed in her scope of practice, he or she is not allowed in the scope of practice for the diet tech to then interpret those labs or give any sort of recommendation for those labs. So the roles are very different. If we continue on with the diagnosis, that's your PES statements. The dietitian identifies the problem and creates a PES statement or a nutrition diagnosis for that. The diet tech can assist with that and give any input as possible. You know, maybe if the diet tech is responsible for speaking with the patient and family and gives that feedback to the dietitian, but they are not allowed to do any sort of nutrition diagnosis or PES statements. Continuing on, the nutrition intervention. The intervention is the dietitian's prescription for how they're going to fix the problem, which we'll get to much later. And it's very specific to the patient or the physician or the facility, and it's very appropriate. The diet tech may be assisting with those interventions, They may be helping with education. They may be monitoring that patient to see if the intervention is initiated. But again, they are not establishing those interventions. They're not creating them. They're assisting and monitoring them. And then finally, the monitoring and evaluation, again, the RRD specifies in her scope of practice what will be monitored and what will be evaluated based on the diagnosis and based on the things and the signs and symptoms. And she'll be documenting, she will be documenting all pieces of that and part of the interdisciplinary team. Now, the diet tech will also aid with that and can help the dietitian keep her eyes and her ears on what's happening. But again, the diet tech is not responsible for creating any sort of monitoring processes or even evaluating things that are being monitored. So here's the scope of practice for an oncology dietitian. And again, this is just one example of there's a lot of scope of practice papers out there. And it breaks it down into different focus areas. I do not have all of them because this document is very, very long, but I just wanted to kind of give you an idea of how your profession will change. You know, as a new dietitian, you're going to be what they call over on the right side, the generalist. Those are the dietitians that are new in the field, probably less than 5 years of experience. They may be in a specialty area. You know, you may get a job working with just oncology patients, or it could be a job that you're in any sort of outpatient setting. You can also, let's say you start out in a clinical setting and you work with a variety of patients, from stroke to diabetes to cancer, but then you get a job 5 years later as an oncology dietitian and you're specializing in that. You may then go back to being a generalist dietitian. Again, a generalist is somebody who's new to that specific area and doesn't yet have the full experience. And the X's that you see under the generalists are all the things that, according to the academy and their scope of practice, that the generalist should be able to do. Somebody who's more specialty is somebody that has a lot more experience in that specific area. And then the last one is advanced, somebody who has multiple years experience. This person may have been in the field for several years. They may be a preceptor for an internship. They're the ones that are very advanced. They're the kind of the dietitian you look up to and hope that you could be as good as them someday. So again, some of the focus areas in 1.1, evaluating dietary intake that affect the health and conditions. As you go down, you can see from generalist to specialty to advanced, they can do almost all of those things. It's when you get to evaluating history of treatment-related side effects and evaluating cancer risk factors that now you see this may not be something that the generalist is adequate in doing. It may be outside of their scope of practice. If we continue down, it's the same thing. This is just a different focus area. Again, you'll see some boxes that are not filled in for the generalist. And in here, we also see one that's not filled out for the specialist. And that would be drawing on experiential and evidence-based knowledge about the client population. It takes multiple years, lots of self-study, and lots of continuing education in your specific field to get to that advanced level for some of these areas. And again, you want to make sure that you are patient with yourself. The academy requires so many hours every year, and the state will require, wherever you end up, so many hours of continuing education, and that is to help you grow. Because you can't be expected to graduate and finish your internship and know all there is to know and be 100% confident in your recommendations. It takes years to advance your skill, and that's what these scope of practice papers will talk about, is how you move through the field and become better and more confident and somebody who's more advanced and has the great recommendations.